Hi, good afternoon. I am the outreach and enrollment worker and Hispanic translator at Barnwell Family Medicine, which is an office of Lowcountry Healthcare System. I have a Master's of Arts in Teaching, and I have been working with the Affordable Care Act for almost a year now. So I have learned a lot in the last year, and I hope to be able to teach you guys a little bit today. Thank you so much for coming, and I appreciate your attention and attendance. And just don't hesitate to either jot down questions if you have any, and we can do those at the end, or if you'd like to just, if it's something pertinent for sure to the whole group, where I'm not explaining something well enough during the slides, please don't hesitate to stop me, and I'd be happy to answer your questions in the middle if you need to. So just some housekeeping really quickly. The material presented in this course was retrieved from the U.S. Preventive Service Task Force and Department of Health and Human Services websites, and it's also from the material developed by CMS. CMS is the federal agency that administers Medicare, Medicaid, the CHIP program, and the federally facilitated health insurance marketplaces. Information in this module was correct as of March 2014, and to check for an updated version of the CMS training modules, you can visit the marketplace.cms.gov, and Diana Kieran will have more specific information as to how you guys can get in touch with me for questions or specifics where you can get the training modules, that URL. To check for updates on the healthcare law, visit hhs.gov/healthcare. This training program material is not a legal document, and official program provisions are contained in relevant statutes, regulations, and rulings. So the Patient Protection and Affordable Care Act is colloquially known as Obamacare. And the other individuals in the healthcare industry and in the health insurance are calling this PPACA. Although everybody knows the term Obamacare, I like to encourage people who are dealing with consumers directly to inform them and make sure they're aware that this is really called at least the Affordable Care Act, if you don't want to go into the whole title. So what is the PPACA, or the Affordable Care Act? Is a law that was signed in March of 2010. It provides minimum standards in our healthcare system and requirements for individuals to obtain health insurance if they can get it affordably. Financial assistance is made available to some individuals, and it also increased eligibility for Medicaid, as well as improving Medicare coverage, requiring 100% coverage for evidence-based preventive health services, which we'll discuss at the end today, and then it prevents discrimination against patients due to pre-existing conditions. That is not by any means an exhaustive list of the 1,200-page law that they signed in 2010. So there are three categories of eligibility that we will discuss today. The first one is the health insurance marketplace. It was created as a part of the Affordable Care Act, and it's a place where qualified individuals and families can directly compare health insurance plans. These are private insurance plans. They're known as qualified health plans, and they can compare them on the basis of price, benefits, quality, and other factors. The health insurance marketplace is sometimes just known as the exchange. There are three different types there you see on the right side of your screen. The federally facilitated marketplace, which is what we have in South Carolina, and many other states in the United States at this point. They have a state-based marketplace where the state itself is responsible for developing, maintaining, and running the marketplace. And then they have a state partnership marketplace, which is in coordination between CMS at the federal level and the state. There's also what's called the Small Business Health Options Program, or the SHOP. And that is the marketplace where small employers can purchase coverage for their employees, and then their employees can go on the shop and pick a plan that is still subsidized by the employer. It also provides, it's totally separate from what I do on a day-to-day regular basis, because it is for small businesses and employers, and I help more with individuals and consumers in the health center and in the community. So what does the application and eligibility look like in the health insurance marketplace? A person submits an application by one of the 4 ways in front of you, and then immediately, if they're doing this online or in person, or actually online is really another way for them to do it. Sorry, in person, the in-person assistance is doing the online application. So if they're doing anything that's not by mail, they should get real-time verification. And the way that happens is they verify and determine a person's eligibility, which is they go through Social Security Administration to make sure people are providing accurate Social Security numbers. They do have IRS tie-ins with that in order to make sure the information they're being provided is accurate, or as accurate as possible. At that point, a person, when they submit the application, will be given an eligibility determination, which tells them what their premium tax credit may be, what their cost sharing reductions, or whether or not they're eligible for cost sharing reductions. And it also will, at that point, allow them to see what qualified health plans they are eligible for. From there, they can choose to go ahead right there and enroll in a marketplace qualified health plan, or they could come back later and do it at a later time, or their information could potentially be sent to the Medicaid office for a determination. In the state of South Carolina, the marketplace does not determine a person eligible for Medicaid. They would see that their information might match up with the Medicaid application and eligibility, and they send that to DHHS for a final determination. So the open enrollment period for 2014 coverage has ended. It ended back in March, I'm sure you guys are aware, with a little leeway in April. Currently, a person can enroll under a special enrollment period if they're eligible. Those are listed there. They're similar to job insurance type special enrollment periods. The next open enrollment period starts November 15th. That coverage will begin January 1st if a person enrolls before December 15th. After that, the rules apply. On the 15th of each month is the cutoff for the following month, and then it would roll over to the month after that. The open enrollment period, the second open enrollment period, will end February 15th, 2015, in order for a person to get that March 1st coverage. So a qualified health plan, in order to be offered on the federally facilitated health insurance marketplace, those plans have to be offered by an issuer that's in good standing with the state, cover all 10 essential health benefits, which I'll cover in a second, and they have to offer at least silver and gold level cost sharing plans, which I'll explain in more detail. And the issuer also agrees to charge the same amount, whether it's offering the plan through the health insurance marketplace or outside of the marketplace in the private sector. There are 4 different insurance companies offering QHPs in South Carolina. Those insurance companies are Blue Cross Blue Shield, Blue Choice Health Plan of South Carolina, Coventry, and Consumer's Choice. Blue Cross Blue Shield and Blue Choice have the same network of providers. They use the same EPO. It's an extended provider network, which is a little bit different than their regular network. And Consumer's Choice is actually a new company in South Carolina. It is a 501c3, and so they are a nonprofit organization who are trying to help people in South Carolina who need insurance. It is usually a little bit cheaper than the premiums are cheaper than the Blue Cross Blue Shield and Blue Choice plans. But again, the network, because that is a new company, the network for that company right now is significantly smaller. And Coventry, I apologize that I don't have very much specific information on Coventry. They are not offered in the county that I primarily assist with, which is Barnwell County. Coventry does not offer any plans in Barnwell County, I know. So the qualified health plans are going to vary similarly to your employer insurance or other insurances that you guys are probably familiar with. These ways listed here. And in addition, some plans are structured differently, like those high deductible plans that are listed there. As well, they have what are called catastrophic plans, which are for people who are ineligible, or the plans on the marketplace are unaffordable to them. They could look at a catastrophic plan, which potentially might be cheap. Those are also for individuals who are under the age of 30. So these are the different plan levels of coverage that I mentioned just a moment ago. There's bronze, silver, gold, and platinum. And the cost sharing reductions are here listed for you. The cost sharing reductions are when a person is below 250% of the federal poverty line, they can get cost sharing reductions. And I apologize that it looks like this slide doesn't have that listed out for you. I apologize. So the silver level plan is where the cost sharing reductions are applied. So for a person who is between 100 and 150% of the federal poverty level, on that silver plan, instead of them paying 30%, the enrollees pay on average 6%, and the plan pays 94%. So if you're jotting down, taking notes, again, I apologize that it's not on the slide. The silver plan for 100 to 150% changes to 94.6. For 151 to 200% of the federal poverty level, that changes to 87.13. And for 201% to 250% of the federal poverty level, that changes to 73.27 for the cost sharing, for the enrollees cost sharing portion. So the essential health benefits I mentioned, I'm not going to list them out for you right now verbally, but you can look at the screen and see that it is very comprehensive coverage. All of the qualified health plans must offer coverage in all of these 10 categories in order to be offered on the federally facilitated marketplace. So who is eligible? There is a little bit of confusion in that people think they've heard everyone is eligible. Well, almost everyone is eligible to purchase coverage through the health insurance marketplace, as you can see on the left-hand side of your screen. That does not mean the insurance on the health insurance marketplace that they are offered will be affordable. Usually the insurance is only affordable if a person is eligible for an advanced premium tax credit. Those eligibility standards are on the right side of your screen. They have to complete a tax return. Individuals who receive Social Security who previously do not complete a tax return or normally don't are allowed to, and that is a way for those individuals between 62 and 65 or individuals who receive disability and that's their only form of income to receive health insurance through the health insurance marketplace if they're not eligible for other minimum essential coverage, like through an employer, Medicare, Medicaid, VA benefits, and other minimum essential coverage offers. The adjusted gross income on the federal tax return must be between 100% and 400% of the federal poverty level. What is the federal poverty level? Most of you guys are probably aware, and I think they might be changing this term. I saw something recently to the FPG, or Federal Poverty Guideline. And these are the numbers actually for the next open enrollment period on the right-hand side of your screen. The minimum that a person must make in order to receive cost-sharing reductions or that tax credit that makes the insurance through the health insurance marketplace affordable. So the next category of eligibility is Medicaid. And if a person is eligible for Medicaid, they are not eligible for the tax credit that provides the affordable cost sharing, the affordable insurance through the health insurance marketplace. As you guys are all aware, South Carolina did not expand their Medicaid program. Now here on a side note, let me mention briefly that they did recently, as of August the 1st, start offering a new program that is called Healthy Connections Checkup. The Healthy Connections Checkup is available to everyone who is under 194% of the federal poverty line, who is not otherwise eligible for a full coverage Medicaid program. The Healthy Connections Checkup will offer a checkup in the doctor's office every other year, and it offers those preventive services that are recommended, that we're discussing at the end by the USPSTF. So colonoscopies and mammograms for individuals who are over the age of 50, which will probably be some of the largest population that is affected by that checkup program. Now our individuals who are between 50 and 65 can get that much needed colonoscopy and mammogram every year, or whenever it's determined that it's necessary for them, as a preventive service. It's not going to cover diagnostics, but it will cover those as a preventive service. A person does need to fill out a Medicaid application in order to be enrolled in the Healthy Connections Checkup Program, unless they're already on family planning, and those individuals will automatically be switched over to the Healthy Connections Checkup Program. As you see here, and I already mentioned, individuals who have Medicaid aren't eligible for the tax credit. And we already discussed that South Carolina is not expanding the Medicaid program. At the beginning, I mentioned that the law requires that a person purchase or attain insurance if it's affordable to them. For the individuals in South Carolina who are not eligible for Medicaid because they make too much or because they're in an individual and they make too little to get the tax credit, these individuals will not be penalized at tax time next year as long as they do everything they have to do. Some individuals don't need to file an exemption application. Some individuals do need to file what's called an exemption application in order to have the penalty waived on their tax return next year. And I am assuming that all of you guys are aware that if a person can get affordable insurance when they file their taxes next year, if they've been uninsured for more than 90 days, they'll have a penalty on their tax return next year, unless they fall in one of those exemption categories. So Medicaid eligibility has changed a little bit in South Carolina in 2014. These are the old and the new, and these new Medicaid rules have opened up eligibility to people who were previously disqualified from Medicaid. Okay. This is another part of the changes in South Carolina. The income limits have been increased, and this is a chart diagramming that for you. There's a 5% disregard that increases all of the limits by 5%, and that's what you see in the right-hand column where it says up to 67 or 199 or 213%. So the Medicaid income limits are delineated here. I have it broken down between the weekly and the yearly for parents and caregivers. That's the maximum. And in the right-hand column is the Medicaid maximum for the age-blinded disabled group. These are the two most popular groups, or I guess the groups that receive the most assistance from Medicaid as adults. And the family size is in the left-hand column right there. So if you look here, you will see the Medicaid limits on the left-hand side, and you see the marketplace minimums on the right-hand side. These marketplace minimums are the current minimums. They're not next year's minimums, okay? So the current special enrollment period minimums are on the right-hand side, and as you can see, there is a coverage gap, quite a large coverage gap in South Carolina. For parents and caregivers, that coverage gap is actually from 67% to 100% of the federal poverty level. All the parents and caregivers in that category are not going to be able to get affordable insurance at this time. Finally and briefly, Medicare Medicare is not a part of the health insurance marketplace, and a person who has Medicare doesn't usually need to do anything. The marketplace doesn't offer Medigap or Part D plans. It doesn't offer anything secondary, and they don't work with Medicare in any way. So a person who is eligible for Medicare, 65 or older, or a person who is disabled and eligible for Medicare is not eligible for the tax credit that makes the marketplace insurance affordable. For those individuals who are 64 and enroll, all they have to do when they become Medicare eligible is just call the marketplace and inform them that they've become Medicare eligible. Their Medicare will start on such and such a date, and they'll make sure there's no overlap in that. So briefly, we will, in closing, discuss the preventive care changes through the Affordable Care Act. And John Cogan actually is a professor who stated in the Journal of Law of Medicine and Ethics, stated from a public health standpoint, the most significant provisions of the ACA are those mandating health plan coverage for evidence-based preventive services without cost sharing. And we see that even played out in South Carolina, because now the Medicaid program, which did not expand, is shifting in order to be able to cover those preventive services as well. So the idea is that the nation will shift from how do we fix this problem and a treatment type mentality to more of a wellness and a whole care preventive type mentality within the healthcare industry. The preventive services mandate in the Affordable Care Act requires that insurance companies, Medicare and Medicaid, provide evidence-based preventive services with no out-of-pocket costs. And that is as long as it is a preventive service. So if you're having a stomach ache and you need to go to the GI for a colonoscopy and it's a diagnostic colonoscopy and you're 55, it's not going to be covered. If you're going at age 55 for your annual preventive colonoscopy, it will be covered at no cost to you. Okay. And the U.S. Preventive Services Task Force is the organization that is charged with developing and maintaining this list. It's made up of 16 non-federal primary care providers who are considered to be experts in their field. It's a 4-year term revolving group, and they provide recommendations of covered preventive services. Their recommendations are broken down into 5 categories, 4 grades in the I statement. The I statement means they don't have enough information at this time to make a grade recommendation. Grades A and B are supposed to be covered, are to be covered at 100% of the 100% of the cost to the consumer. Okay. Grades C is sometimes covered, or it depends on the situation. And then grade D is recommended against in regard to whether or not the insurance company should cover this preventive service. And this is a list of the current grade A and grade B recommendations that should be covered. And as you can see, there are age limits there, and there are other qualifying factors depending on a person's situation as to whether or not the preventive service would be covered. And we didn't have very much time today, but again, my name is Kelly Diedemeyer. I work in Barnwell, and if you would like to get in touch with Diana Karen, you can, or if you'd like to get in touch with me at my office, you can do so as well. Thank you.
Okay.
Other questions?
Are there any questions for Kelly? None? Okay.